So basically, you're a surgeon.
Yeah.
You're a surgeon who turned into functional medicine. I'm so curious, like how and why did you turn your focus into functional medicine?
So if you ask any of the functional medicine practitioners, at least in the US, it's always the same story. Something happens to you that makes you question the conventional medicine aspect of your treatment that doesn't sound right. And then you dig in and you find that there's an alternative approach to it that's much safer and maybe even more efficient. So in my case, I discovered by chance that I had a Hashimoto disease, which is an inflammation of the thyroid gland. It's an autoimmune disease. And when I went to my friend endocrinologist, I asked him, what should I do? He says, look, your hormonal levels are perfectly fine. You just have the antibodies, so you just live with it for the next few years to come. And once your hormones go down, then I'll treat you. And I found it very frustrating to wait basically for me to get worse to start having treatment. So I looked into the research, the literature. I found some things that the conventional medicine was already saying, that selenium and vitamin E could help. So I started this, and lo and behold, my antibody levels went from 17,000 to 300 within a few months. And once you start that rabbit hole, you get to know about functional medicine. I got to know about Mark Hyman and the IFM, and it took me a year to find out which way I wanted to be trained, and to find the functional medicine university from America. And I did that online training, and it was a night and day. And in parallel of this, I kept having these patients coming to me, like I was telling you earlier, patients having nothing to do with general surgery. So I'm a consultant in general surgery. So basically, I remove lumps and bumps, and I do belly stuff. But they would come to me and mention, I don't know, some hip pain or some weird rash on their skin or some brain fog, and I could not help them before. So all combined kind of led me to that functional medicine approach to be more wholesome, I would say, to have a larger view of all their symptoms, combine them all together and make sense of it. And that's it. And I've never been happier since I started. So
that's beautiful. And usually in general surgery and in conventional medicine, the doctors usually go for the quick fixes, treating the symptoms instead of treating the actual cause. How easy was it for you to make this transition?
Oh, well, so I think I like to think that I was always... so I'm a Muslim, as you can figure out from my outfit. Religiously, we don't take into surgery very lightly. It has an implication to get into somebody else's body, and I was always conservative in that regard. Then you remove the religious aspect of it. You have the French training that I have, and in France we are very conservative because of financial considerations. I would say we have a social security system which is very famous in the world, and for that reason, when a person undergoes surgery, the whole nation pays for that surgery. So you tend to not push that patient towards surgery if it's not really mandatory. So you've got two parameters that always made me think twice before offering surgery to a patient, if there's any valuable way otherwise. So I was not quick to pull the trigger with my patients. So it's not such a big change with functional medicine practicing now. If anything, I'm more able to convince my patients to accept that there is another way. And I think they're appreciative of this, because no one, when it comes to surgery and to hold the knife, I think no one wants to be cut out if there's any alternative.
Exactly. And how much of the diseases that you've seen is actually like stress related, chronic stress related?
So it's general surgery. It's the gut-brain. We know that axis, that communication in the two ways. It's brain to gut and gut to brain. With the lifestyle, it's a very tricky question because it's either a direct burnout relation or indirect. But I would say most of the diseases that I see with regards to the gut come from a lifestyle issue, and that lifestyle often enough is due to a wrong coping mechanism that is based on food improper intake or timing improper. So you could say the vast majority of the diseases could be preventable if you would work on the burnout symptoms, yes.
Okay. So basically what you're saying is that most of the tummy diseases are because of stress and burnout.
Yeah.
Okay.
I would say that, and I would say the opposite. I would mean also that most of the neuro symptoms could also be connected to origins from the gut as well.
Interesting.
It's very interconnected. It's a loop.
Okay.
It's difficult to say what's the first, chicken or egg, but you find them both involved most cases. Most cases you do.
So you have to work because a lot of the people, everyone almost, is going when they're talking about, I want to deal with this stress and I want to become mentally fit. Let's go to a therapist. Mm-hmm. Let's do coaching. Mm-hmm. So, but what you're saying is that if your tummy is not okay, if your gut is not okay, then mentally you cannot be okay.
I would say that. I would make that bold statement.
It's a bold statement. It's not a bold statement. I mean, it's definitely not a bold statement. I do believe in that. I see myself how I behave or think when my tummy is bloated, mm-hmm. when I've had a lot of gluten and I'm gluten sensitive, when I have a lot of sugar, I see how I see things and I behave, and I see how it affects me mentally. That's interesting.
Frustration that can arise from a patient that goes and consult a psychotherapist, not seeing any improvement after that, because it's not just sometimes. I think more often than not, people are conscious and aware of what's going on. So having someone open your eyes about what's going on is not going to help because it's not enough.
Okay.
What they can help with could be working on the motivation to perform the changes that you need into your lifestyle and daily habits. That can be a strong help for sure. Mm-hmm. As per psychotherapy to
completely fix the problem?
There's no one therapeutic arm. You have to use multiple weapons, if I can say, to address it. Because again, if you have like an octopus in front of you, fighting one arm is not going to be enough. You have to handle all of them in due time. So it has to be. That's why the term holistic is there. It's really just you have to address the problem from all its angles. One angle is never going to be enough.
Exactly. And how do you define stress? This is one question I ask everyone.
How do you define stress? So I would say it's a stimulus that comes interfering with your homeostasis. That means your balance, causing disorder, trouble. I make it as wide as possible, that definition. Why? Because stress can be physical and can be emotional. And the emotional can also cause the physical stress with the stress hormones as we know them, etc. So I guess, yes, stress is related to a stimulus or unexpected or expected stimulus causing chaos or disrupting the balance in yourself, whether it's chemically or mentally, leading to disorder and imbalance. Yeah.
How much of our stressors do you think, or our diseases, we inherit from our families? The epigenetics of...
So are you talking about the epigenetic levels or the transgenerational emotional burden?
Aren't they the same? They're not the same?
They are not the same.
Okay, interesting. Can you tell me, what is the difference between epigenetics and intergenerational traumas and stressors?
So there's the epigenetics. It's the idea, the notion, it's more than an idea now because it's been proven. It's some very subtle changes into the DNA that can lead to a certain phenotype, that means a certain expression into your body or your enzymatic reactions, if present in a certain environment. They may remain silent if you're in the best environment possible. That means if I put you yourself in an environment which is, let's say, in the forest, you live by yourself, you do yoga, you do intermittent fasting, no one here to bug you, and you sleep on time, you eat on time, it's perfect. These epigenetic changes will not lead to anything sick, any diseases or any symptoms. If I put your same self into, let's say, the World Trade Center, I have you skip meals, I have you be drunk on coffee and caffeine or fast food, I have you being stressed out by kids, having to pick them up from school, have you, your mother-in-law is at the house causing you trouble, I have you, like all these stresses all around you can promote the expression of those epigenetic changes leading you towards diseases. Mm-hmm. So it's epigenetic, it's the notion of potential for disease when placed in the
triggering environment.
Yes.
Okay.
So that's where the patient should be empowered, because really their health is in their hands when they know that. Mm-hmm. Now, transgenerational trauma is a different notion. It's the notion that we inherit the history of the traumas of the past generations, but mostly parents, grandparents, into our fascia, into the tissues, the deep tissues of our body. And there's nothing you can do about it. You inherit them. But once you've had Olivier, who works at the Neuralink approach about trauma in the fascia, once you find the right person like Olivier to treat them, these trauma deep into your fascia, then you can actually be freed of them. You release them away. Mm-hmm. You force your brain to integrate them, to deal with them, and then it's gone. You pass on to the next problem to solve. I'll give you one example. I've visited Olivier, and he found some my maternal grandfather's trauma into my liver fascia, and my grandpa fought against the French in Morocco for the liberation of Morocco, and that's that trauma that he found there. So it's very deep. It's like very unexpected. I did not expect to see this into my body, but there you go. Mm-hmm. Very interesting.
It is very interesting, to be honest.
Olivier must have told you there's the story behind endometriosis in females. I don't know if he addressed that topic. We had a discussion once. He says that endometriosis happened in a lady whose mother or grandmother might have some second thought about their pregnancy, or might not have wanted a daughter. But it's a women passed on trauma through generations, usually grandmother or mother, with the unwanted pregnancy or unwanted child, or accident pregnancy, something related to that.
I want to talk about the gut.
Sure, please.
Let's talk about the gut now.
That's my baby.
Tell us, how can someone who's having bloating, constipation, diarrhea, understand what's happening in their gut?
So,
what is the first step? If someone came to you and said, I have...
Usually, when they come to me, they almost all the time they have these symptoms. I will start immediately talking about SIBO. Mm-hmm. There's a high likelihood for them to have SIBO because I know how they live. I know how we live in this community in the UAE, and to me, the vast majority of people will be SIBO positive. I know for a fact. I don't even feel the need to test them for it, because that's how spread out it is. Every patient that comes to my clinic, I will find one or another symptom, digestive symptom, leading towards SIBO. I know I'm being bold here, but honestly, it's a fact. All the patients that come to my clinic will have some sort of discomfort, digestive discomfort. So I will tell them, given these symptoms, there's a high likelihood that you have an imbalance between your bacteria or your viruses or your parasites or your fungus, because the gut is not just bacteria, it's also yeast, it's also fungi, it's viruses and parasites. Not all parasites are bad. So it's a huge, rich mix. It should be rich at least. But once you have an imbalance between all these bugs, there you start having these symptoms.
Okay. If your gut is functioning optimally, can it heal diseases, or it can contribute to the overall well-being of someone?
Look, it's simple. So, some of my teachers in the functional medicine university, they actually healed some autoimmune diseases that are not known to be healed in the conventional way. Some of them had Crohn's disease, some of them had Hashimoto, some of them had, like, you name it. There's even one that's kept her cancer dormant for decades. So, yes, if you fix the gut, there's a very big chance, serious chance for you to fixing a lot of other symptoms. And I've seen it in my patients too. I mean, I had this patient once, I hope she won't mind me quoting her story, but she came to me for heavy breasts and pain. I interrogate her and I find out that she has more than heavy breast issues. She has also issues with her periods. She has depression, which is treated with drugs. She had anxiety, which is treated with drugs. Insomnia, treated with drugs. Irritability. She had obviously, bloating, constipation or diarrhea. I forget which one she had. And she also had vertigo. A vertigo that was scanned with CT and MRI, and nothing was found to explain that vertigo. She's seen ENTs and neurosurgeons, no possible cause. She was only treated symptomatically for that one with beta-circ, I think. Comes to me for the breasts. So I explained to her breasts related to most likely estrogen dominance in her case due to possibly insulin resistance. Insulin resistance could be coming from a bad food intake or SIBO, or both. And she does the MRI of the breast, obviously, so for us to rule out any abnormalities, and she was fine. But I treat her for SIBO. And lo and behold, she comes to me 6 months later. Her hair has grown that much. She's got the banana smile, ear to ear. She stopped taking on all the antidepressant, sleeping pills, the one for anxiety as well. And the vertigo has gone. To this day, I don't know what caused the vertigo. I have some assumption, but I don't know for a fact what caused it. But it has gone. So it goes to show you, the gut is the key that opens a lot of doors. A lot of doors. So you start with the gut, you will never go wrong.
Oh, perfect. And since we're talking about the gut, let's talk about the probiotic and how long should people use it? Because many people don't know that the probiotic should be consumed for a short period of time. It's not a long period, supplement.
So probiotics are good. I'm never going to say they're bad, but there's a know-how to use them. Basically, remember, you go back to the root cause. If you have an imbalance between the good bacteria, the bad bacteria, or the good viruses and the bad viruses, you need to reestablish balance. That means increasing the good ones, yes, which is what you do with the probiotics, but that also means sometimes to kill off the bad ones first. So what I tend to do with my patients is to kill off the bad ones first, and at the same time reinstall the good probiotics for a certain amount of weeks, not months, weeks. There are more than millions or billions of bugs in our gut. So obviously getting a probiotic that has maybe 4 different types of bacteria in it will not change the entire mapping. So overdoing these 4 might cause you also some sort of trouble. And I've had patients not understanding why they would not get rid of their bloating and bad mouth breath while taking so many probiotics. I had one, she was taking, I think, 3 to 4 different kinds and very heavy concentration, but very repetitive. I mean, she did not see the names of the bacteria behind, but it was very redundant. I had to explain to her that taking all these at once for a long time was actually causing harm more than good. So she had to actually do a window of, stopping taking any of them, see how she was doing, and then start again afresh. So probiotics, yes, but you have to do it under supervision because sometimes you might not take enough or sometimes you may take too much or too long.
And if they took it for a long time, does it lead to a leaky gut? Because the leaky gut is a bit of a fancy term that's being thrown around a lot nowadays.
So the thing is, if you take the SIBO for the probiotics for a long time, it might lead to SIBO because you're disturbing the balance between the bugs. So that leads to SIBO, small intestinal bacterial overgrowth. You lead to that overgrowth. SIBO, if you let it evolve for some time, it will lead to leaky gut. If on top of that you're not having the proper food, you're having pro-inflammatory food, you're having food that you're allergic to, because having SIBO for a certain amount of time, we're talking about months, can lead you to develop new food allergies that you never had before. This was my case, by the way. So these new food allergies that you do not know of will cause you a very secretive inflammation. Not all inflammation signs will lead to fever and acute pain. Some of them, it only causes bloating. Some of them, some dryness of the skin. Some of them, dryness of the eyes. Some of them, hair fall. There's a variety of symptoms. So to do the probiotics use them in the wrong way can lead to SIBO, and SIBO for a certain amount of time can lead you to leaky gut and new food allergies. Yes, definitely. The probiotics are now they are in fashion in many different fields, including dermatology, and you would be surprised. You will see now, if you go into all these Amazon and Noon and Alibaba or whatever websites, you'll find creams, facial creams with probiotics in it. Why? We discovered that these probiotics are not only anti-inflammatory in our gut, but also on the skin. I've worked with a friend of mine in South Africa in the burns unit, and he's tested probiotics as cleansing products in his ICU burn unit. Half of it, he was using that cleansing product, and the other half, he only used alcohol-based general antiseptic, the usual that you would find in a hospital. By the end of the study, he was able to decrease the complications of hospital-acquired infections by half in the whole unit, just because half was cleansed by probiotics. This gave me the idea to do some research on infected wounds. When I was in Rheims, I was taking care of a very, very vulnerable population in ICU, very old patients, or vulnerable in the sense that they would have kidney failure, so dialysis, liver failure, heart failure. Because they're in ICU and they're bedridden, they don't ventilate normally, they all have tracheostomy. They stay put, so they tend to develop bed sores, these ulcers into the skin that go sometimes as deep as to the bone. And obviously, being in an ICU department, you are exposed to bugs that have resistance to antibiotics, and hence resistance to antibiotics, because they learned, due to the pressure of our antiseptic and antibiotics, they learn to survive those conditions. So these bugs are called virulent because of that. So the infected wounds were a puzzle for us to solve. I decided to, on a compassionate case, he had a stump infection. We had amputated his thigh, his legs to the mid-thigh. And the stump was healing perfectly within 3 weeks, and then he started to dehisce and to get infected. And I had no solution. I could not take him back to OR because he was too fragile. I started probiotics on it, like locally. And believe it or not, within a month, we went from a stump that was completely blackened by necrosis to a stump that was gorgeous and pink, ready to be closed again. That gave me the idea to extend the study, and we have now 8 cases where I've used probiotics topically, and we've healed, hang on to your socks, we've healed patients that had ulcers close to the anus, having diarrhea, so fecal contamination of the ulcers every day, on a daily basis. We applied probiotics, covered it as much as we could with gauze that would go away anytime, and changed it daily, and they would heal that ulcer. They would heal that ulcer. Probiotics only. Not using antiseptic, not using antibiotics, not using anything but the probiotics. Probiotics are doing a job locally that the immune system in the vulnerable patient cannot do anymore. They compete for food with the bad bacteria. they release a lot of acidity, which is bad for the bad bacteria and good for the good bacteria. They release a lot of enzymes as well that attack the biofilm that these bad bacteria build up to protect themselves. So overall, probiotics are the best friends we can have in the gut, but somewhere else as well. The skin, I've heard of ophthalmologists that use drops of probiotics for conjunctivitis. You can really use it in many ways, many different ways. And this again goes back to a root notion. I mean, probiotics, they've been known for thousands of years and used for thousands of years. So
what is the
so much better
most
than any
interesting
other wound care product
recovery story that you have come across from a patient that came to you?
Well, that vertigo lady was really impressive for me.
Okay.
I've had autistic kids, to be honest, coming to me for different reasons. One came to me for a burn of the hand because I also take care of wounds, chronic and acute, and he was just impossible to bandage while being awake. So I had to put him under sedation to treat him. That's how bad he was in terms of irritability and hyperactivity. He was 3. So when I spoke to the parents about certain things we could do on the gut of the child to help him with these symptoms, they were more than okay to do that, because at that point he was having black teeth because of the amount of sugar they gave him just to calm him down in public spaces. He was with a lollipop all the time, just to cool him down. So they started that protocol, and his father actually told me. I caught up on the phone with him, and he told me he was giving more eye contact with his brothers and sisters, and he was playing more with them and more manageable in public spaces, including the school. I think he was either kindergarten or school. So they were overall very happy about it. The good thing is that he was still being breastfed at age 3, so that was a very good point on his part. There was another case. She was a dentist. She came to me for a bleeding, but you interrogate the patients and you find out so many other aspects. This is how I go. I go by chapter. I go with the gut chapter. I go by the brain chapter. I go by the skin, joint, and muscle chapter, and then I go by the hormonal chapter. So if you do this approach systematically for every patient, you'll never miss any symptom. I came up with a list of symptoms that because when you ask patient, do you have any other symptoms, they'll say no. But if you dig in, you'll find like 15 of them. They don't think of it because people don't have the tendency to complain about their health.
Or they normalize it.
Yes, there's a lot of normalization.
They lived with it for such a long time and it became normal.
It is true because after all of them, they say the same, but everyone has this. Because everyone has this, it has to be normal. No. Everyone has this, yes, but it's not normal. Absolutely not. It's disease. So she came to me and I found out that she was having headaches, like migraine, not headaches, migraine, proper migraine, issues with weight loss, constipation and blah, blah, blah. The way I got to know about her improvement is that she actually sent me patients. She referred patients to me. And the patient told me that she was doing so well. It was before her follow-up, like within 4 weeks of her treatment, she was doing so well that she was starting referring patients to me directly. So she was amazing. That was a very good result. I got to a point where I can actually promise them a change within 6 weeks. Like it's that our health is that bad. Let's be real. Our health is that bad that if you do the right thing for only 6 weeks, you will see a change. You will see a change in terms of sleep, weight loss, bowel motion, mood, even hormonal stuff. Mm. And I think if people knew more about this possibility, I think they'd be more prone to make the change, to take the leap.
Okay. So I want to talk about burnout now.
Mm-hmm.
Have you ever treated patients who came to you with other symptoms, but the main reason was burnout?
Only recently, because I only took that functional medicine path 100% recently. So yes, I have. Otherwise, as a general surgeon, you can understand that burnout would not be. And the problem is in the UAE, it's a nation. The expat nation community is here to work. They're not here to laze around. So even if they are burnout, they will not complain about it because they know they have no choice but to continue with it. They have to perform. Performance is key here. You have KPIs, CPGs, you've got items to, markers to show your performance, your achievements, and if you get behind, if you get behind, you're gonna have to answer to that. And but I do get a lot of stressed people due to workload or family load sometimes that we have to address. Because I have no choice but to address it. Remember, I cannot treat the gut if the burnout is still going on, if they're still suffering from their extended hours at work, or if they're still suffering from the same stressor from the family or the environment. I have to address it. So yes, you come across them, but to treat them specifically, only recently, yes. And I think there's a big demand on it. I have a friend, he for some reason researched what's the most researched complaint that's done on Google by potential patients. It's burnout and pregnancy also, like how to fall pregnant. So burnout is a big thing. I think we need to address it
exactly,
drastically.
And many people, to be honest with you, they don't even have the word for burnout. They have all the symptoms, but they don't have the word for it. They just feel like, oh, okay, I'm tired. That's it. And
at the same time, it's been used, overused maybe. Like they tend to use it for every time they have a blues or a kind of we call it a coup de mou in French. They're kind of on the low side of their mood. That tends to make it to normalize the burnout, the true burnout, where you can't even get out of bed, where you can't even stand for a certain amount of time. Because you don't have any pleasure in it, you don't have any motivation for it, you're just empty. You've got no will to do anything. This is the proper burnout that has a base with the fatigue of the adrenal glands because they're completely empty, they have nothing more to give because you use them so much.
Give me 3 habits that you would advise anyone who's listening to us today to follow to feel better physically and therefore emotionally as well.
3 habits, that's very limiting. I've got a bunch in my bag right now.
Give them to
3.
me.
I'm going to give 3. I would
give as much you want. I mean,
I would say movement. So movement is key. We have a very sedentary lifestyle that actually that I have been suffering from. It's funny because I'm treating people, but I'm suffering at the same time to provide all these advices. These advices, I have to sit down with the patient for long hours. If I don't move, I get depressed, and I see the damage it does to my body. Movement is key. Any type of movement. You may go for a walk for an hour. An hour is a minimum. Fast walking to the point that you lose your breath while talking to someone in case you were talking. 1 hour of fast walking, brisk walking, they call it, every day. That's WHO guidelines, I think, for people like me, like you, or housewives who stay seated most of the day. But you can go also even, more diverse. You can go do yoga for 20 minutes. You can go do some resistance training. Move. You just need to move. You need to be vertical. You need to move yourself daily. You can't be sitting at your house, sitting in your car, sitting at your desk, and then sitting at your car again and at your house, pretending to rest from your day sitting at your desk. You can't. This is not resting. This is not. You need to move. You need to be vertical. There's a lot of... To make that point clear, if you don't flex your muscles, especially the lower leg muscles, you don't maintain lymph flow. Lymph is the liquid beside blood that contains most of the toxins. If you want it to be out, all this amount of toxins, you need it to go back to the heart. It can't be pumped up without muscle flexure, muscle contraction. And if it stays there, it's going to lead to water retention, the edema, the congestion of your legs. And then the more it's congested, the less you have the will to move around. So it's a vicious circle. you want to detoxify, you want to sweat. So another part of it would be to sweat either through workout, that's the second point, either through workout, as we mentioned, with moving, or make yourself sweat with sauna. Yes, sauna would be the best, I think, easiest. Now, there's more and more buildings coming up with the sauna within the residence, but you can go into any club, gym, whatever they have it. You do for an hour in a week. You don't do it continuously an hour. You can do 2 sessions of half an hour. But sweat is a key for detoxifying. It's also good as you do that sauna to train yourself and do some breathing exercises there so that you can tolerate the heat. Calm you down, do some meditation, mindfulness as you do that sauna. That would be your moment for you, the moment for you where you're alone, you're by yourself, you're focusing on your health, you're breathing. That uses the parasympathetic pathway. That parasympathetic, I don't know if I'm sure you know what it is, but just to remind people, this is the quiet nerve, the one that will lower down your BP, lower down your heart rate. That's the one also that gives you the butterfly in the belly when you're excited. That's also the one that's involved into the digestion system. So promoting its activity helps regulate a lot of issues and symptoms that you have. And breathing exercise, it's the cheapest thing you can do to promote its activity, especially when you breathe out long. So what I tell my patients would be to breathe in while counting to 3 and breathe out in an extended way, counting to 10. And try to breathe out, getting your belly to go inside, using your diaphragm, because using your diaphragm is also pressing on the vagus nerve, which is the parasympathetic nerve. It presses on it, stimulates it too. So you do a massage of that nerve, plus you do that breathing exercise. You repeat the cycle for 2-3 minutes multiple times a day, especially before you sleep, because it calms you down. I've used it in patients while doing surgeries under local anesthesia. You know, those patients who can't even see a needle, can't even bear the idea of pain. What I did is I monitored them for BP and heart rate, and I had them do the breathing exercise as I was doing the infiltration. Within a minute, you could lower the heart rate of 20 pulsations per minute. Within less than a minute, and same goes for the BP. It's an amazing, powerful exercise, cheap. You can do it anywhere in front of people, alone. It doesn't matter. So you've got movement, you've got sweat, you've got the breathing exercise. Man, I've got plenty more. I was going to go into intermittent fasting to decrease.
Please go. Can I? Yes, of course. I actually wanted to talk about intermittent fasting.
Sure.
Yalla, continue.
So I know for a fact that it's not. A fasting timing is not going to suit everyone the way I'm going to describe it, depending on if you're a man or a woman in your premenopausal or postmenopausal period of life, if you're a child, etc. But what I found as an experience on my patients, on myself and my family and extended friends, is that when you live your life like a farmer, which is you wake up early, you have your breakfast, a good one, like it has to be the king of meals, your breakfast. Then you fast for 8 hours, and then you have your lunch, which will be in the late afternoon, if all goes well. And you don't snack in between, and you don't snack afterwards, but you drink. It's fine to drink water and green tea. And then you sleep early, not so far after the sun has set. That's the best scenario in life. When you live with the sun, you go back to your root, you go back to the basic. Your hormonal cycles are all in sync with the sun and moon cycles as well. So when you follow that order, nothing will go wrong with you. And with this intermittent fasting, you keep your insulin to the lowest level most of your day. When you count, that means you have 16 hours of insulin being at level 0 because you don't eat anything. So you don't spike insulin or anything. And if you have these big meals spanning the day the way I've described it, you don't feel hungry, you don't suffer from hunger that much. So it is compatible with the life of a worker because I've done it for years. And I'm to the point where I don't even feel hungry enough to have lunch now. I could actually be happy and content with just a very heavy breakfast. But you have to mind that you need all the nutrients in one meal, so that can be tricky. But for the time being, 2 meals spread 8 hours apart morning time, afternoon time, and then khalas. Breakfast. I know no one that skips breakfast that is healthy. I keep saying this to my patients. All my patients, they come to me, but I do intermittent fasting. I only do lunch and dinner. I don't do breakfast. I hate this formula because if you don't have breakfast, that means you will break down sugar with your cortisol, which is one of the stress hormones. So if you rely on that, then you'll empty your adrenal glands ultimately. You don't want to do that. And most of the time, the patients who do that, who say that to me, they're overweight. They're not even having the BMI that they should have. So it's not working. It's not working. If you live like this, waking up early, you put your eyes into the sunlight for 5 minutes, by the window, by the balcony, you have your big breakfast. You may do a workout before that big breakfast so that you only absorb what you need from that big breakfast. You have that fast of 8 hours and then you eat your lunch while being hungry. I've noticed now that if I eat not being hungry, I don't digest so well. I need to be hungry. I need to have enough acidity in my stomach to be able to process the food I'm going to eat. So I'm no longer eating under peer pressure or social pressure. Mm-hmm. I'll eat if I need to eat. Otherwise, I don't. So Bravo. I know it's an issue for people having outings and gatherings at night, especially in the UAE, because they eat very late. But I'm trying to motivate my patients otherwise. I'm trying to tell them that health is a priority. Mm-hmm. So social gathering is very important Mm-hmm. It plays a big part into your health. I know that. It doesn't mean that you have to be away, but people have to understand if you can't eat, if it harms you, you can stay with them, drink some water, drink some tea with them, but don't eat. Stay with them, but don't eat at night. SIBO tends to be promoted by people eating late at night. It's known to provoke nightmares. You know that? Like most of the people having dinners, they will tell you, I always ask, they don't have a good quality sleep. They have nightmares. They also have the tendency to have reflux, regurgitations, and they cough sometimes because all these acidity, the gastric content, they come back into the throat. And when you're lying down at 0 degree and you don't control that much what's in your throat, you might inhale it, and that can cause asthma.
We're not supposed to actually eat this much, right? We're supposed to only eat once or twice.
So 3 times
every few days.
So 3 times, I don't think there's a need. We are more sedentary than we've ever been. I took the example of the farmer for a reason. The farmer used to have a very physical practice, tending to the cattle, tending to the soil. That's very physical, but that's also very meditative. When you think of it, when you do apply your mind and your focus to a simple task, it allows you to kind of, meditate and breathe very slowly. Our sedentary life, being at the desk or a housewife all day, does not need this amount of calories of a 3-meal set. 2 meals, I could get behind, but 3 meals, no, I do not abide. So there's been a promotion of, people now. There's been a lot of diets that you've heard from Hollywood and the Americans. The 5 tiny meals a day or the multi-snacking and everything. I don't know the science behind it. All I see is that eating that many times in a day will only promote having high insulin levels in your blood, and overworking your stomach, maybe lowering your acidity production capacity after some time. We are not meant to eat all the time. No, we are not meant to eat like that. Like I said, fasting, I think there's been a lot of publications about it. I think it's strong enough for people to understand fasting. There's virtue in it. And Eric Berg, that man that's been doing a lot of videos about functional medicine online, he's mentioned a study about the Middle East people and the Muslim community as a group have a tendency to develop less cancers than the rest of the world. One of the reasons is the fasting that we do 1 month a year.
Exactly. Yeah.
So it goes to show you the benefits of it. Yeah. Overeating, it comes from a different culture, and also a different need that is pathological. Some people, they get dopamine out of food because they go for comfort food. Compensation, exactly. Yes. It's a coping mechanism that's wrong.
Exactly.
You should find another coping mechanism.
Exactly. Autophagy, I think this is what you spoke about the reason why, Muslims have less cancer is because of fasting. And what does fasting do? Autophagy, right? So the good cells eat the bad cells. So the body cleans itself.
One of the good things, autophagy is one of the good things that comes with the fasting, but it's not the only one. Like I said, you keep your insulin levels, your insulin needs down to the minimum. Insulin in itself is a hormone that promotes inflammation. When it's elevated, when you have a person that has, let's say, hemoglobin, glycate hemoglobin, HbA1c, it's a marker that we use to see the exposure to sugar for the past 3 months. When it's elevated, let's say 5.8, 5.9, I'm strict. I consider this as pre-diabetes. This pre-diabetes state means that you are prone to have high insulin levels at all time in your blood. Insulin is a hormone that means it has receptors on each and every cell of your body. It promotes some DNA expression or inhibition as a hormone. It promotes an inflammatory state, but it also promotes the rise of IGF-1, which is a factor that has been known to be a key player in some cancers as well. So insulin is central to a lot of things, a lot of diseases. So if you control your insulin levels, you actually control a lot of potential for disease that your epigenetic might have exposed you to. You understand? Again, we go back to environment. So if you eat less, you have less insulin, then your epigenetics stay quiet. It doesn't lead you to disease. But if your insulin is high, then you open the gate to inflammation, to autoimmune disease, to cancer, chronic inflammation overall.
Yeah. I think we touched on every single thing that, is relatable to most people.
Yeah.
You explained it beautifully. You explained it in a very simple, non-doctor language. Yes, definitely.
Awesome.
Do you agree?
Yes, I did actually learn quite a lot.
Oh, wait.
Yeah. Awesome.
Glad. And thank you so much. Honestly,
My
thank
pleasure.
you so much. This was such a pleasure having this conversation with you. And this was really good.
Pleasure was mine.
Thank you.